These are 12 common nighttime habits that quietly cause heart attacks and strokes while you sleep. Most seniors believe these behaviors are perfectly safe, and medical research proves they can be fatal to your cardiovascular system. Every single night, your body enters a window where the danger climbs. 22% of all sudden cardiac deaths strike between 10 p.m. and 6 a.m., according to the Oregon Sudden Unexpected Death Study published in Heart Rhythm in 2021. Survival rates for these nighttime events are far worse than daytime events, with only about 35% of people achieving return of spontaneous circulation at night, compared with 40% during the day. And that's before the morning hits. A 40% excess risk of heart attack and a 49% excess risk of stroke pile up in the 6 a.m. to noon window, fueled by changes in your body that start building while you're still lying in bed with your eyes closed. The American Heart Association recognized the gravity of all this in 2022 when they added sleep to their cardiovascular health framework, elevating it to what they now call Life's Essential 8. What happens during the night now ranks alongside blood pressure, cholesterol, and exercise in the American Heart Association guidelines for protecting your heart and brain. Today, we are walking through every one of these nighttime dangers one by one. If you do even one of these things, this video could save your life. Stay with me until the end, because the last habit we cover is something almost everyone does, and the research behind it is alarming. 1. Eating a large meal late at night. Millions of seniors eat a big dinner right before bed without thinking twice about it. That habit forces your heart into overtime at the worst possible time. An 800-calorie meal redirects roughly 500 milliliters of blood, about a pint, straight into your digestive system. Your heart rate climbs, and the reflexes that normally stabilize blood pressure get knocked off balance, as documented in the American Journal of Physiology in 2021. And this is where it turns dangerous for anyone with coronary artery disease or narrowed arteries from atherosclerosis. Circulation published a study in 1998 showing what doctors call a coronary steal phenomenon. Blood flow to heart regions supplied by narrowed arteries actually dropped after a meal, falling from 1.01 to 0.76 milliliters per minute per gram of tissue. That kind of reduction can starve your heart muscle of oxygen, and up to 10% of patients with chronic ischemic heart disease experience chest pain after eating because of it. Over 103,000 adults tracked for more than 7 years gave us the clearest picture yet. That was the Nutrinet Santé cohort study, published in Nature Communications in 2023. And it showed that eating your last meal after 9 p.m., compared with before 8 p.m., carried a 28% higher risk of cerebrovascular disease, which includes stroke and transient ischemic attack. Every additional hour of nighttime fasting trimmed cerebrovascular risk by 7%. Most people never think about this next part. Late heavy meals trigger acid reflux, and that reflux stimulates the vagus nerve, which runs a direct line from your esophagus to your heart. Vagal stimulation can kick off atrial fibrillation, the kind that tends to appear at night, during rest, and right after meals. Research in EP Europace in 2017 showed that treating the reflux reduced atrial fibrillation symptoms in 78% of cases where reflux esophagitis was present. The AHA took this seriously enough to release a 2017 scientific statement on meal timing and circulation, recommending that people consume most of their daily calories earlier in the day. Their 2025 circadian health statement doubled down, confirming that the eating and fasting cycle acts as, and these are their words, a dominant synchronizer of circadian rhythms in peripheral organs, including the liver, heart, kidney, and pancreas. Finish your last meal at least 2 to 3 hours before bed and keep it light. That one change alone can take real pressure off your heart overnight. 2. The blood pressure medication. Timing controversy. This next one created genuine confusion for millions of patients around the world, and the answer only became clear after years of debate. Back in 2020, a Spanish trial called the Hygia chronotherapy trial made international headlines. Researchers tracked over 19,000 hypertensive patients and claimed that taking all blood pressure medications at bedtime slashed cardiovascular events by 45% and cardiovascular death by 56%. Numbers like those would have made bedtime dosing the single most powerful move in all of cardiology. None of it held up. The European Heart Journal issued a formal expression of concern, stating the trial is under investigation. Officials from the European Society of Hypertension called the results, in their words, just too good to be true without bias at play. Nobody had conducted independent data verification, and the study protocols never appeared publicly. The real answer arrived with the TIME study, published in the Lancet in 2022. Over 21,000 patients across the United Kingdom were randomly assigned to evening or morning dosing and followed for more than 5 years. No difference showed up in vascular death, heart attack, or stroke between the two groups. Two Canadian trials, BEDMED and BEDMED-FRAIL, presented at the European Society of Cardiology Congress in 2024, landed on the same conclusion. A combined analysis of all 5 randomized controlled trials, covering over 46,000 patients, sealed the case. When limited to the 3 trials with low risk of bias, morning and evening dosing produced identical outcomes. Professor Brian Williams from University College London put it plainly. The TIME study is the definitive randomized controlled trial, and the answer is no, he explained. Patients should take their tablets when they are most likely to remember to take them. Which means the real threat is not morning versus evening. The real threat is forgetting to take your medication at all, and we will come back to that one later because the numbers are staggering. 3. Sleeping on your back. Most people never consider that the position they fall asleep in could threaten their heart, but medical literature describes supine sleeping, lying flat on your back, as the most common aggravating factor for obstructive sleep apnea. More than half of all sleep apnea patients get worse in this position because gravity drags the tongue and soft palate backward, collapsing the airway. A systematic review found that the apnea-hypopnea index, which counts how many times per hour your breathing stops or turns dangerously shallow, roughly doubles when you sleep on your back instead of your side. A large Korean study tracking nearly 4,000 patients recorded the index spiking past 50 events per hour during REM sleep in the supine position, compared with just 16 during non-REM lateral sleep. Fresh data from a 2025 analysis of the Sleep Heart Health Study, which enrolled over 5,000 participants averaging 63 years old, tied longer supine sleep time directly to increased angina risk. Every 10% increase in time spent on the back corresponded to a 3% bump in angina. One small intervention study demonstrated that avoiding back sleeping for just 1 month dropped 24-hour blood pressure by 6.4 over 2.9 millimeters of mercury in sleep apnea patients. That is a meaningful reduction from nothing more than changing position. Dr. Susan Redline from Harvard and Brigham and Women's Hospital kept her advice straightforward. If they have sleep apnea, sleeping on your side in most cases may be very helpful, she stated. For heart failure patients, the AHA notes that left-side sleeping should be avoided due to discomfort from an enlarged heart, which makes right-side sleeping the best option for most people. Positional therapy devices exist for people who roll onto their backs during the night, and even sewing a tennis ball into the back of a sleep shirt has helped train people to stay on their side. 4. Drinking alcohol before bed. A glass of wine to help you drift off sounds harmless, and the damage it does to your heart overnight is anything but. 35% of atrial fibrillation patients name alcohol as their most common trigger, making it the #1 self-reported cause of episodes. A landmark study in Annals of Internal Medicine in 2021 tracked 100 people with prior atrial fibrillation using heart monitors and alcohol sensors over 4 weeks. More than 2 drinks within 4 hours made participants 3.5 times more likely to go into an atrial fibrillation episode. Arrhythmia is only part of the problem. Alcohol wrecks the cardiovascular recovery that sleep is supposed to provide. A study in sleep demonstrated that pre-sleep alcohol drove up nocturnal heart rate, crushed beneficial heart rate variability, weakened baroreflex sensitivity, and amplified sympathetic nervous system activity, all in a dose-dependent pattern. A 2021 crossover study confirmed that evening binge drinking gutted cardiac vagal tone across nearly all sleep stages, dragging those protective indices down to waking levels. That wipes out the normal nighttime blood pressure dip your cardiovascular system depends on for repair. Newer research has only tightened the case. A 2022 Mendelian randomization study from Massachusetts General Hospital and the Broad Institute linked alcohol intake at every level to higher cardiovascular disease risk, with harm climbing exponentially past 7 drinks per week. Among 432,000 primary care patients studied in 2025, weekly alcohol above recommended limits carried a 26% higher coronary heart disease risk overall and 43% higher risk in women specifically. The World Health Organization declared in January 2023 that no level of alcohol consumption is safe for our health. The AHA's 2025 scientific statement in circulation reported that 3 or more drinks per day is consistently associated with worse outcomes across every cardiovascular disease category. Dr. Marianne Piano from Vanderbilt University, who chaired the AHA writing committee, was direct about it. People who do not drink at all definitely have a lower risk of having atrial fibrillation, she explained. One drink kept well before bedtime is the safest approach for those who choose to drink at all. For anyone already living with atrial fibrillation or heart disease, the evidence keeps pointing in one direction: no amount of alcohol qualifies as truly safe. 5. Going to bed. Dehydrated or overhydrated. This nighttime danger cuts in both directions, and getting it wrong on either side raises your risk. 6 to 8 hours of sleep without a single sip of water thickens your blood measurably. Plasma volume contracts, hematocrit rises, and research published in 1993 recorded hematocrit running 4.2% higher in the morning compared with the evening, with whole blood viscosity elevated across all measured levels. The Edinburgh Artery Study, which tracked nearly 1,600 adults aged 55 to 74 over 5 years, revealed that blood viscosity in people who went on to suffer cardiovascular events measured significantly higher than in those who stayed healthy at 3.70 versus 3.55 millipascal seconds. Those researchers wrote that blood thickness variables carried at least as much predictive power as conventional risk factors like smoking and LDL cholesterol, and a 2025 study in the Journal of the Neurological Sciences tied higher blood viscosity specifically to wake-up stroke in patients 65 and older. Over 20,000 adults followed for 6 years in the Adventist Health Study produced some of the most striking hydration data available. Drinking 5 or more glasses of water per day versus 2 or fewer was associated with 54% lower risk of fatal coronary heart disease in men and 41% lower in women. One counterintuitive finding stood out. High intake of fluids other than water was actually associated with increased risk, likely because caffeinated beverages pull water out of the body. The opposite extreme creates its own emergency, especially for heart failure patients. Lying down redistributes fluid from the legs into the lungs, which can trigger pulmonary edema and paroxysmal nocturnal dyspnea, that terrifying experience of waking up at night unable to breathe. 80% of hospitalized heart failure patients present with pulmonary congestion. Aim for at least 5 glasses of water spread throughout the day, but do not flood your system right before bed. Anyone living with heart failure should follow their doctor's specific fluid limits, typically 1.5 to 2 liters daily. Bedroom temperature does more than affect comfort. It directly alters your cardiovascular function while you sleep, and extremes in either direction carry measurable consequences. Cold activates the sympathetic nervous system and drives vasoconstriction, tightening blood vessels and forcing blood pressure upward. A controlled study showed that pre-hypertensive men sleeping at 16 degrees Celsius versus 23 degrees experienced an exaggerated early morning blood pressure surge, with sympathetic activity spiking during the 4 to 6 hours after they fell asleep. Framingham Offspring cohort data captured a 10 mm of mercury average swing in systolic blood pressure between summer and winter, and a separate study of over 5,000 patients followed for more than 8 years linked each 10 mm of mercury increase in nighttime systolic blood pressure to a 21% jump in cardiovascular mortality. Seasonal death patterns hammer this point home. Across 19 countries and more than 54 million deaths, cardiovascular mortality ran consistently higher during winter in both hemispheres. Canadian records covering nearly 160,000 heart attack deaths showed winter mortality 9.8% above summer levels, with stroke mortality 14.3% higher and peaking in January. For adults over 85, the gap widened to almost 16% more heart attack deaths and over 19% more stroke deaths during winter months. Excessive heat creates a different set of problems. A 2025 study of 47 community-dwelling seniors showed that bedroom temperatures climbing above 75 degrees Fahrenheit elevated heart rate and reduced heart rate variability, both signs of autonomic disruption. Japan's Smart Wellness Housing Survey, tracking nearly 1,500 participants, found that homes below 12 degrees Celsius carried more than double the odds of electrocardiogram abnormalities compared with homes at or above 18 degrees. The recommended range for older adults falls between 65 and 72 degrees Fahrenheit, according to the Sleep Foundation and Cleveland Clinic. For the general adult population, the target narrows to 60 to 67 degrees. The WHO sets a health protection minimum at 64 degrees Fahrenheit during cold weather, with higher floors for vulnerable groups. Emotional stress does not just feel terrible. For an aging heart, it can be directly lethal. A 2024 meta-analysis pooling 33 studies and over 43,000 participants tied elevated stress hormones to a 63% higher cardiovascular disease risk. Norepinephrine topped the list at 68% increased risk, cortisol followed at 60%, and epinephrine came in at 58%. Cortisol normally bottoms out around midnight, but chronic stress holds it elevated, and that robs the heart of its nightly repair window. How lethal acute stress can be showed up starkly during the 1994 Northridge earthquake. 24 sudden cardiac deaths occurred that day, against a typical daily average of 4. Only 3 of the 24 involved physical exertion, which means the emotional shock alone stopped 21 hearts. Takotsubo cardiomyopathy, known colloquially as broken heart syndrome, demonstrates the extreme end of this mechanism. Massive surges of stress hormones can balloon and weaken the heart, and it strikes postmenopausal women overwhelmingly, with nearly 90% of cases female and an average age around 66. The International Takotsubo Registry, published in the New England Journal of Medicine in 2015, logged approximately a 5% in-hospital mortality rate with emotional or physical stress triggering 85% of cases. Screens add a second layer of damage through a completely different route. Harvard research demonstrated that 6.5 hours of blue light exposure suppressed melatonin for twice as long as comparable green light and shifted circadian rhythms by 3 hours versus 1.5 hours. Even 8 lux of light, roughly double a night light, proved enough to disrupt melatonin production and circadian timing. Both the AHA's 2025 Multidimensional Sleep Health Statement and their 2025 Circadian Health Statement back this up, confirming that bedtimes at midnight or later raise hypertension risk and that light exposure disruptions push cardiovascular disease risk higher. Turn off the television, put down the phone, and give yourself at least 30 to 60 minutes of screen-free quiet before bed. If worry or anxiety follows you under the covers most nights, bring that up with your doctor. Your heart registers every burst of stress whether you realize it or not. Let me pull this all together. Between the time you turn out the lights and the time you open your eyes in the morning, your body runs through a gauntlet. Blood thickens, clot-dissolving ability drops, and sympathetic activation builds toward a crescendo that peaks in the first hours after waking. Every common nighttime behavior we covered today, from late dinners to alcohol to missed medications to sleeping flat on your back, layers additional strain onto a system already under pressure. Sleep apnea stands out as the highest stakes finding, confirmed across multiple landmark cohorts with a clear dose-response relationship. The morning surge phenomenon has been replicated in dozens of studies spanning every continent. Medication non-adherence delivers consistent hazard ratios no matter which population researchers study. 5 actions can protect you starting tonight. Get screened for sleep apnea if you snore or drag through your days exhausted. Take every prescribed medication consistently, every single night, with no skip doses. Finish your last meal at least 2 to 3 hours before bed and keep portions small. Set your bedroom thermostat between 65 and 72 degrees Fahrenheit. And treat the first hours after waking with particular care, easing out of bed slowly, and staying alert for any warning signs like chest pressure, arm pain, or sudden weakness. Send this video to someone you love who is over 60. It could save their life. If you found this information worth your time, subscribe and turn on notifications so you catch our next one. I will see you there. Take care of your heart tonight.